Hello, my name is John Lockhart. I'm a postdoctoral fellow at Moffitt Cancer Center in Tampa, Florida, and today I'm excited to present our work on a promising machine learning pipeline for analysis of lung adenocarcinoma models, along with some of the insights this tool has helped us discover regarding p53 mutation, tumor progression, and tumor heterogeneity. Tumor heterogeneity is now recognized as both an important prognostic marker as well as a potential driver for cancer progression, immune system evasion, and resistance to therapies. However, detailed histological analysis of preclinical models, particularly those with a high tumor burden, can be quite challenging due to a variety of factors including reproducibility of analysis, training requirements, or expert rater availability. To overcome these challenges and to gain a better understanding of what oncogenic processes contribute to tumor heterogeneity, we've developed an automated analysis pipeline that utilizes machine learning to quickly and accurately grade mouse models of lung adenocarcinoma, a common form of non-small cell lung cancer. The current grading system for lung adenocarcinoma is largely based on nuclear atypia, with low-grade tumors having fairly normal nuclei and higher-grade tumors exhibiting alterations in nuclear shape and structure. We based our pipeline on a pre-trained ResNet 18 model and performed further training on a 36,000 element library of 112 by 112 micron image patches that were consistently graded as normal alveolar, normal bronchiolar, grade 1, grade 2, grade 3, or grade 4 adenocarcinoma by 2 to 3 expert human raters. The training library was constructed from 41 whole slide images of hematoxylin and eosin stained sections from 4 different mouse models to ensure that our pipeline could be generalized to other models after training. This pipeline for grading of lung adenocarcinomas with simultaneous segmentation by an artificial intelligence, which we call GlassI for short, outputs a map that provides an overview of the distribution of tumor grades throughout a slide along with detailed results tables for individual tumors. After 20 training epochs, GlassI achieved a micro F1 score of 0.88 on our test dataset, meaning that for 88% of pixels annotated as tumors, GlassI assigned the same grade as human raters. It is important to note that human raters typically assign a single grade to a tumor, while GlassI assigns grades at single pixel resolution. The benefit of this higher resolution grading is readily apparent in the high degree of intratumor heterogeneity found by GlassI that was not reported by the human graders. This intratumor heterogeneity contributes significantly to the less than perfect accuracy seen in our testing data. As shown in this example, the higher and lower grade regions GlassI identified within a tumor that was annotated by our expert human raters would be counted as errors even though GlassI has correctly identified it as a tumor. As an initial test of GlassI, we analyzed 2 different mouse models of lung adenocarcinoma. The first model, which I'll refer to as K mice, carries an activating mutation in the KRAS oncogene. These K mice are one of the most commonly used models of lung adenocarcinoma and provide a good baseline for the investigation of other mutations. The second model, which I'll refer to as TK mice, has the same KRAS mutation but also includes the deletion of a tumor suppressive isoforms of the p53 family member TRP73. While TRP73 is not frequently mutated in lung adenocarcinoma, our lab has previously shown that the loss of TRP73 phenocopies many common p53 mutations that are found in lung cancer. Both of these models of lung adenocarcinoma are induced by intratracheal installation of a Cre recombinase packaged in an adenoviral vector when the mice are 8 to 10 weeks old. To facilitate comparison to human raters in these analyses, we used GlassI to assign a single overall grade to each tumor. Using GlassI's pixel-level grading, we can calculate this overall tumor grade using a similar algorithm to that employed in clinical analysis, in which a tumor is assigned the highest grade that comprises at least 10% of the tumor area. Both human raters and GlassI found an increase in the number of tumors in TK mice, indicating that the loss of TAP73 contributes to tumor initiation. While there is not as consistent of an agreement, we also found that the tumors in TK mice tended to be of a higher grade than K mice, which implies that TAP73 loss may also contribute to tumor progression. In addition to analyzing individual tumor grades, we can also use GlassI to investigate the intratumor heterogeneity of each lesion. This type of analysis gives us a powerful tool for exploring changes in tumor composition and progression. By examining the distribution of tumor grades within individual lesions, we can see that TK mice have a larger proportion of tumors that are predominantly grade 2 and grade 4. In contrast, K mice have more grade 3 tumors, and these tumors appear to have a much lower heterogeneity than grade 3 tumors found in TK mice. We can also use the area of each grade within a tumor to calculate the Shannon diversity index as an estimate of intratumor heterogeneity. From this, we find that the tumors of TK mice tend to have a higher degree of intratumor heterogeneity than K mice. This is also appreciable when looking at the tumor grading maps that our pipeline produces. This tool is still a work in progress, however, I hope it's able to provide a strong case for its utility, even in its current form. A few of the ongoing projects we're using this pipeline for include accelerating characterization of other models of lung adenocarcinoma, developing and testing novel therapeutics for lung cancer, correlation with immunoassay slides to further refine tumor classifications, and targeting spatially sensitive omics techniques to uncover the molecular drivers of heterogeneity and tumor progression. All of this work would not have been possible without the strong collaborative team we have at Moffitt Cancer Center. In addition, we are very grateful to the National Cancer Institute and Moffitt Cancer Center for the funding that supports this work. Please feel free to contact me with any questions or comments you may have, and thank you for your attention.